I'm Dr. Tracy Stecker, and welcome to the Choosing Help podcast. Choosing Help presents conversations about courage, connection, and the transformative power of asking for support. Through candid discussions, expert insights, and real-world stories, this podcast breaks down stigma and opens doors to understanding. Join our community committed to compassion and courage. Because when we choose help, we choose life. This is Dr. Tracy Stecker, and I'm joined today by Dr. Sudie Back. Dr. Back is a licensed psychologist and a professor at the Medical University of South Carolina. She is a widely known expert on PTSD and addiction. And that's what we're going to talk about today is PTSD and addiction. She has received numerous awards from many institutions, including the Department of Defense, the Department of Veterans Affairs, the National Institutes of Health, among others. We are really thrilled to have her here with us today to talk about this serious and challenging topic. So when somebody experiences a traumatic event, which could be defined as experiencing or witnessing potential threats of death or injury, serious injury to either yourself or to others, it can really shatter one's sense of safety. So, Dr. Back, thank you for being here. Could
Thanks for
you
having me.
could you talk a little bit about the difference between trauma, post-traumatic stress disorder or PTSD, and then what some of the symptoms of PTSD might look like for someone?
Sure. And thank you again for having me here to talk about these important topics. Traumatic experiences, as you described, are very common. Most people in our society, in the world, will experience at least one traumatic event in their lifetime.
Mhm.
And those can vary widely from sexual assault, or it could be military, combat related traumas, natural disasters like hurricanes, and earthquakes. The list goes on. So there's a wide variety of different types of traumas that people experience, and those are very common. Post traumatic stress disorder, or PTSD, is when individuals experience a trauma and um, most people will have symptoms of PTSD soon
Mhm.
after a traumatic event. More than
Mhm.
90% will, but a minority of individuals will end up developing PTSD. So around 20 to 30%, depending on the sample. And with PTSD, it's when those post traumatic stress symptoms become debilitating
Mhm.
and are causing significant problems in the person's life. So, those are things like they're having a lot of intrusions about what happened, can't stop thinking about it. They might have flashbacks where
Mhm.
they kind of feel like they're right back there in the moment. Um, Avoidance is a big symptom. So they're trying to avoid, which makes a lot of sense, right? Trying to avoid thinking about it, talking about it,
Being in the situation again.
being in a situation that might remind them of that. Um, and then changes in their mood.
Mhm.
So oftentimes, negative affect and things like sadness, grief, um, fear, shame,
Mhm.
guilt, and anger come up. Um, Changes in how they think about themselves, the world, and others um, are common symptoms too. And then symptoms of hyperarousal. So feeling on edge, oftentimes looking, scanning, being on alert, having trouble sleeping, startle response is high, and then sometimes reckless behavior associated with that too.
Which might look like what?
Sometimes it could look like excessive substance use,
Mhm.
or sometimes it might look like driving very fast, riding a motorcycle very fast, doing a number
Mhm.
of different things that could potentially be harmful.
Reckless spending,
reckless
reckless
spending.
behaviors. Okay, and just to stay on the reckless substance use for a minute. So,
Yeah.
substances might serve two purposes for somebody who's experienced a trauma and is struggling with symptoms of PTSD. It could help that hyperarousal, help them calm down, help them potentially sleep, help them maybe forget or numb out. And then on the other hand, there's the potential problems associated with substance use.
Yeah. And oftentimes, people will tell us that's why they started using, or that's why they were using excessively, because they wanted to dampen down those hyperarousal symptoms, which are really uncomfortable.
Yeah.
Or they want to sleep because a lot of them are getting several hours of sleep. So
Hmm.
people sleep 2 hours a night or 3 hours a night, which can impact so much. However, um, by the time folks come in for treatment, they realize that it might work in the short term, like the very short term, for a little bit, but we know it's not a good long-term strategy, and that trying to reduce PTSD symptoms using substances, although it's what most people, it's the only thing they know how to do in
Hmm.
that moment,
Hmm.
it actually makes those PTSD symptoms worse.
Hmm.
The way that it interacts with our bodies, our minds, it increases those hyperarousal symptoms and worsens sleep. So,
Yeah, it's really unfortunate. I've worked with several veterans who have PTSD, and they have reported that same thing that they initially just started to drink. It might not have really ever drank much in the past, but they just wanted to go to sleep. They wanted to be able to relax at the end of the day, not have the thoughts disturbing them, calm
mm-hmm,
their mind a little bit and go to sleep. And then
right,
it worked. It worked for a little while. So
a
they
little
had
bit.
something that worked for them. And then it starts to turn. It no longer works. And then, like you said, it actually becomes a problem and even exacerbates some of the
Right.
symptoms.
And so we talk about this like vicious cycle
Yeah.
where, PTSD symptoms are getting worse, the substance use is getting worse, leading to the PTSD getting worse, the substance use. So it's just a really, really tough spot for people to
Yeah.
be in.
You mentioned people when people come to treatment, and I know, and I would love for you to talk a little bit about many people do not attend treatment for PTSD, as well as many people who do attend treatment do not stay in treatment for PTSD. So, can
Yeah.
you talk a little bit about the thoughts that somebody might have, somebody who's struggling with PTSD from a trauma, they have substances on board. What are their thoughts about seeking help? What keeps them from coming in?
Yeah. Well, most people with PTSD and substance use disorders unfortunately don't receive treatment.
Hmm.
And so there can be a number of different reasons why, not necessarily mutually exclusive, but one of the big ones is not knowing that treatments exist.
Hmm.
So when we have individuals in our trials, who stay with us, who complete the treatments, and they feel so much better, they often will say, "I wish I had known about this years ago.
Hmm.
Um, you guys should tell more people about this." We're like, we're trying. um, but so they don't know because I'm not sure that we, in our field, do a great job at getting the word out and marketing um, and letting like the general population know about evidence-based effective treatment. So that's
Can I?
one.
I'm
Yeah,
going to
yeah,
stay
yeah,
there just for 1 second. Because this is my area, stigma and
yeah.
resistance to treatment seeking.
Right.
There are a number of people that I've spoken to who report that they're not coming in for treatment, because they'll just get a medicine, and their thought is
Mm,
there is no medicine for PTSD. They don't know about a medicine for PTSD. There's nothing
mm,
anybody can do. It's not
mm-hmm,
like they can take away the trauma. Um,
mm-hmm.
and I don't want to talk about it. So
Yes.
there is this futility, this thought, unless they know about these treatments, that there's no medicine. They're
Right.
just going to make me talk about it. I don't want to talk about it. So
Yeah.
I
Yeah.
think you're right that perhaps we could do a better job of letting the community know there are
Yes.
treatments. Um,
For PTSD and for substance use disorders. It's the same thing when I have spoken with individuals in the community or loved ones of people who are struggling with substance use disorders. They didn't know that there are FDA approved medications, and
mhm,
particularly for alcohol use disorder, that can
mhm,
be very effective, certainly for opioid use disorder.
uh-huh,
Um, we need more treatments, right, for a number of our other substance use disorders out there, but there's FDA approved medications for PTSD too.
mhm,
Sometimes people do best when they have both, when
mhm.
they have both like talk therapy or cognitive behavioral therapy plus medication for their substance use disorder.
And can you talk about the treatments for PTSD for a
Yeah.
minute? I know you're
Yes, because that kind of relates to maybe one of the reasons why people don't come in for treatment. So let's say they do know about treatments that are available, but they're still not seeking treatment. One of the main reasons could be that um, they know that they're going to be talking about,
right. They don't want to
right?
talk about it. Yeah.
No, which is a sign of PTSD. It's a
Mhm,
symptom of PTSD, avoidance.
mhm,
And I can't think of any other psychiatric condition or mental health problem where not talking about it would be the most helpful option, right?
mhm,
So we know that talking about what they experienced and how it's affected them can be really, really therapeutic. And I think that sometimes people might worry um, about, oh gosh, am I going to go in the first session and then I have to share all these details and share everything, and I don't know if I can handle that.
mhm,
I don't feel ready for that.
mhm,
And so sometimes that can keep people from coming in. Although you don't have to, I'd like to clarify, you don't have to talk about everything all at once. You know, most of the treatments are gradual, even our, like prolonged exposure type of trauma focused treatments. There's still a way to do that gradually, but it does involve talking about, to some extent, what they experienced.
mhm. And it's important to note that because avoidance is a key feature of
Yes.
PTSD. And I do think there's that perception that if you're going in for treatment, you're going to have to talk about what happened to you as soon as you hit the chair.
Yeah, no, you
That
don't.
is
It's
not
okay.
true. No,
Yeah, absolutely.
it's
Yeah,
not
it can
true.
take a minute to
Build
just,
rapport,
yeah,
understand the process,
exactly. Feel
and
comfortable with the therapist. Like, yeah, develop
and
trust.
one of the other things is in treatment, you learn various coping skills to manage
Hmm.
some of those strong emotions.
Yeah,
So part of treatment is rebuilding really, because that got
yeah,
destroyed from the trauma, rebuilding your sense of control over your own emotions. And so when
yeah.
you're ready, we're gonna build you up first. Then when
Yes,
you're ready, we can
yes,
practice using those skills and very,
yes.
very effective.
That is a great point. But yeah, nobody is just thrown into the deep end, you know. They are taught to swim. They are taught several different techniques for swimming, can
Mhm.
practice them out and see which feels
Which
best
works
for
best.
them. Yeah,
Yeah.
there's flotation devices. There's a number of different, um, you know, measures that are taken to help it, be as supportive and compassionate and effective as possible. So you're not doing it alone.
And
Yeah.
so some of those flotation devices, I'm just going to grab onto that for a second, might be substances. Many people report that using substances help calm them down. And so
Mm,
it's complicated when somebody is using substances with PTSD because they believe that coming to treatment means you're going to take that away from them, which is terrifying. It might be the only one, even if it's not working anymore, it might be the only one they truly feel any sort of control over. So the thought of losing that can be really terrifying for some people.
Yes. And I think that's one of the main reasons too why a lot of people didn't go into integrated or didn't go into substance use disorder treatment because before we had integrated treatments, which I'm happy to tell you about,
Yes, please do.
um, it was more like it was more the sequential treatment model.
Hmm.
So people would come in and they would first, the really only option was to get treatment for the substance use disorder, defer talking about the trauma, defer working on the PTSD until they were generally abstinent and
Hmm.
had a while of abstinence, under their belt. But that's really, really hard for a lot of people who have been using the substances in that way as a coping mechanism, you know,
Flotation
a
device.
flotation device. Yes, in that moment. Um, and so integrated treatments have come about to help people um, treat both at the same time. Since for many people they're very interrelated, whether
Hmm.
it's um, you know cues that remind them of a trauma and that makes them want to use, or they can't sleep like we've talked about and they want to use, or after years or decades, it's also habit and now they have both conditions.
Hmm.
But yes, we teach people how to manage their emotions
Hmm.
because a lot of times the substances have been used to manage those emotions. And for individuals with substance use disorders, when they start to cut back or they quit using, they're feeling a lot
Yeah.
that maybe they haven't felt in a really long time.
Yeah.
And so helping them develop the skills and the confidence to sit with, to manage, to observe, um, to understand that those feelings are temporary. They are big
Hmm.
feelings, but like a wave, they go up and they go down. And
Hmm.
so they're learning to kind of ride those emotional waves, and treat their PTSD and their substance use disorder so they can really have long-term healing.
Yeah, it can be, you just think about how complicated it can be for somebody, even just one symptom, hyperarousal. You might see something, see someone, let's say somebody walks by and it reminds you of somebody who was there during
Mm-hmm.
a traumatic event. Your
Mm-hmm.
heart rate goes up. And then
Right,
all of a sudden that heart rate you get is associated with trauma because of course the heart rate was probably up that day as well.
right,
And
right.
so even something like a raised heart rate, like even during exercise
Yeah,
or during
yeah,
excitement. So even something like experiencing a fast heart rate might get somebody feeling, oh no, I'm uncomfortable. Oh no, I might be in danger. Oh no, I might
yes,
be unsafe.
right.
I need to get my heart rate down. I need to calm down. I need help. I need help.
Yeah,
And so they might reach for a substance just to
right.
calm themselves down. And then that gets really reinforced if it works.
Totally.
And if it worked at all, even for a
Yep.
while, it's reinforced. So it can be so complicated and sort of,
Yeah,
I don't know the word I'm looking for, but just really kind of surrounding multiple aspects of their life and their
yeah.
functioning. And so
And
coming in for treatment is could potentially be terrifying. And so if we can say anything today on this podcast, it's we appreciate that. We
yeah,
we know that and we have
yeah,
treatments which will go gently forward and
yeah,
but first step is getting that comfortable with those feelings again, even that feeling of discomfort. You're not
right.
going to necessarily need to talk about it. You're certainly not going to talk about it session one, but
Yeah,
but
yeah,
we're going to work with you on how to um, process that experience in a way that makes you feel like you can get through
right,
the discomfort when it emerges.
right. And even in some of the treatments, in session one, it's learning a breathing retraining skill. So they're learning how to regulate their breath and their breathing, and they'll be able to see that by doing so, it decreases their heart rate. They can feel their heart rate coming down. because if their heart rate is coming up and it's not exercise, like we would want the heart rate to come up. If they see someone that looks like their perpetrator, for example, and their heart rate comes up and they want to decrease their heart rate, or they just had a stressful day, they want to decrease their heart rate, that's okay. So we'll teach them a breathing relaxation exercise so that they know they have that ability within themselves. They don't have to use substances. There's other ways that we can teach them so that they can rely on those healthier skills to manage those big emotions.
So important. I just had a fast heart rate because my dog just barked like a
That's what I
crazy
thought.
lunatic. Bear had to join the show
There,
today.
love it. Yeah, that's great. Yeah,
Okay. Do you want to talk for a minute about a cope? Cope is one of those treatments, therapeutic interventions for um, co-occurring
right.
PTSD and substance use. Would you
Yes,
take us through what cope might look like?
sure.
Oh,
And I have one of the manuals here too.
excellent.
So COPES, it has been, we've been working on it with myself and a number of colleagues, including Kathleen Brady and Tracy Colleen, folks at MUSC, and other places around the world
Mhm.
on COPE. And so COPE uses prolonged exposure and cognitive behavioral therapy for substance use disorder together.
Okay.
It's 12 sessions, individual therapy sessions, although we are working on a group-based format, hopefully soon too. And it's a very structured program that walks people gradually towards being able to approach the memories, to be
Hmm.
able to approach talking about that with someone,
Hmm.
approach things in their life that they have been avoiding that maybe remind them of the trauma in some way, or they need to be able to do to function, for their
Right.
life. And then again, the cognitive behavioral therapy piece for the substance use is teaching them those skills to manage also thoughts about using, to manage stimulus control, like do they have it in their house, their car, to manage refusing an offer from a variety of different people.
Including yourself, right?
Yeah,
Yeah.
including
Yeah.
yourself, right? Um, and then managing those cravings too.
Hmm.
And then we
The,
talk about
the
anger
20
because,
minute wave.
yeah, exactly.
Yeah.
Manage that the wave of craving and the
Hmm.
wave of anxiety. They're um, they're very similar in that they're time limited.
Hmm.
Cravings, we know, only last on average like 15 minutes or less.
And I think it's so important to get this out because when somebody is experiencing that craving,
Yeah,
there's a build for it, and it feels like it just feels overwhelming, like that wave.
right.
It's building, it's getting stronger and stronger, and they can't focus on anything except wanting their substance of choice.
Yeah,
To know that that's time limited, that that's a wave. Yes, it is
right,
building. You're correct. It's getting stronger and stronger.
right.
But
Will
if you can
calm
go
down.
to that other side, that it'll get
Exactly.
better. Yeah, just wait
Right,
through the first wave.
right.
Yes, the waves still come, but not as frequently
Yes,
as they might initially.
right.
They get farther apart and they're not as strong.
Exactly.
Yeah,
Exactly right. Yeah.
really important to let people know. So you said COPE is
Yes.
prolonged exposure
Right.
plus CBT. And so
Yes.
for anybody listening, maybe a family member knows somebody in their family has really been struggling since a traumatic event, and
Yeah.
they're using substances. Could you explain a little bit what prolonged exposure is and
Sure.
CBT?
Yeah, definitely. And we do these in a really integrated fashion. So from the very first session, it's talking about how they're connected, and how they influence one another.
Yeah.
So prolonged exposure is just a technical term for approaching, really.
Hmm.
And so there's two types that we use. That one is called in vivo exposure, which just means in real life, you're going out and practicing and getting more comfortable doing things that have been a little scary to you before that are safe. And
Mm-hmm.
we focus on things that are objectively safe,
Mm-hmm.
or very low risk, right? And also things that are safe in terms of substance use too.
Mm-hmm.
So you'll create a list. We call it a hierarchy.
Mm-hmm.
Create a list of things. And each week you're working with your therapist to kind of just build up slowly over time, gaining confidence, gaining skills so that you can master those situations, so that they're not as hard for you anymore. They might still cause a little bit of, distress to do them. There's some things that maybe all of us would never feel totally comfortable doing, but they can do it and they can manage it, and it's not as bad as they thought, right? So
Yeah.
that's in vivo exposures. And these vary. Sometimes, we've had people who couldn't leave their house,
Right.
or they couldn't drive to the store.
Right. The world started to feel unsafe, and so they
Yes,
tucked
they get
in. Yeah.
so isolated, right? And the world just shrinks so much, their life does.
Mm-hmm.
So getting out and doing some of those things. And we personalize it. So that list is super personalized for each
They make the list. The therapist
together.
is not making less. Right.
They're working with them together.
Okay.
The therapist can help suggest things that for people who have experienced the types of traumas that this particular patient or client has,
Right.
they can help them with that. Because sometimes people have been avoiding for so long, they don't even realize they're avoiding.
Right.
They're
It's
like,
just who they
no,
are now.
yeah,
Yeah.
I don't go out and never go out to eat, or I never go to the store,
Mm-hmm.
order groceries, online.
Mm-hmm.
But so there's some working collaboratively on that.
Okay.
And then the imaginal exposure piece is just talking through what that experience was, kind of gradually building up, and then processing it, like you said.
Mm-hmm.
So thinking through a lot of different facets of that experience and kind of their thoughts about it, their feelings about it, how it might relate to other things that they have experienced too, and just
Mm-hmm.
helping them, come more to a sense of peace.
Right.
Always be a terrible thing that they experienced and they went through, but the goal is not to forget about it, right?
Mm-hmm.
But to not have it impact their life as
Right.
much as it does now.
Mm-hmm.
Yeah.
So almost like that changing the meaning of it. Yes,
Mm-hmm.
the event itself, the experience was obviously traumatic, um, and horrific for a person.
Yeah.
Um,
Yeah.
it's not taking away the horror. It's being able to still live your life
Mm-hmm.
within um, the knowledge that you had that experience. So I don't think I said that very well at all, but
You did. You did. You did. Yes. No, that's exactly what it is. And helping people, sometimes it's really helpful to get another person's perspective.
Mhm.
Um, Even just stepping back from that, it can be really healing and therapeutic to share something awful that you went through with another human being who is compassionate and who
Mhm.
wants to hear. Because a lot
Yeah.
of times people don't have people in their life who really want to hear and who
Mhm.
can really sit with them through that.
Mhm.
So it can be very healing to share with another human being, have that connection, and then to have that other person, the clinician, maybe help you think about it or look at it, in different ways.
Mhm.
So, for example, a lot of times people will blame themselves for what happened. I should have known this was going to happen. I should have prevented this from happening. If I hadn't been wearing that, it wouldn't have happened. So, just helping them kind of look at that a little bit more, um, to see what do they really believe about that, right? And
Mhm.
that can sometimes really help them with self-blame or guilt that they might have been carrying around for a long time that they don't need to carry around
Yeah.
anymore.
Yeah.
They don't
Just
need to.
change that meaning of that just a little bit. Just a little.
Yeah.
Yeah.
Sometimes people have big epiphanies too.
Hmm.
They are, they haven't thought about it because they've been trying so hard not to, right? So they haven't had a chance to really sit down and think through it from start to finish. It's sort of like if you're watching a scary horror movie,
Hmm.
the movie's on, and then you might just fast forward through some of the really bad parts or like
Yeah.
cover your eyes.
Yeah.
And so this is like, let's watch the movie. Let's watch
Mhm.
it together and then we're going to talk through it. And the more you do that too, that the easier that really does get for
Yeah.
people.
Yeah. And so I appreciate the truth that for some people listening, they might think, "Woo, too painful
Yeah. Yeah.
for me." And
Yes.
so I think we just want to emphasize we definitely appreciate that. You're an
Yes.
expert on PTSD. You have worked with thousands of people.
Maybe, yeah. Yeah. It's so
Thousands.
appreciate that.
Hmm. And the truth is, there isn't anybody who comes to treatment for trauma who wants to talk about it. It
Right.
is incredibly painful. Um,
Yes.
and it's also true that talking about it magically does have healing powers. Um, we do it gentle. We do it in ways
Yes.
that you're supported, and so
Yes. Right.
that's what we're trying to offer, I think, to people is just this
Yeah.
understanding that we appreciate the pain. We're not going to take away the pain. We're just going to help you live with the pain in a totally different way.
Yeah. And it's important for people who are thinking about this for themselves or for their families to know too that you're going to be in the driver's seat. You're going to be in control.
Hmm.
So your therapist will not make you do anything. They might encourage you or, kind of explain their thinking around it. Provide you with some information on what we know, in the scientific literature. But ultimately, they're partnering with you, and you're really in control.
I I know we talked about the prolonged exposure component
Yeah.
and a little bit about the CBT component. Maybe we should go back to that CBT component though for those who don't exactly know
Sure.
what that is. And the reason why I brought that back up is because there might be people listening who are hearing this and saying, I went to that. I went to that one first session, or I went to two sessions and I didn't like it. Was
Yes.
out of there. We also are letting you know, please come back.
Yes.
You're welcome back, even if you
Yes.
bounced out. Many
Yes.
people who experience a trauma, and there's that avoidance component. It does get uncomfortable sometimes. It might even feel like too much, and you might be saying something to yourself like, I need a timeout. I'll
Yeah.
go back when I'm ready.
Yeah.
Um, it does happen. It's
Yes.
okay to come back.
Yeah.
We have lots of
Absolutely.
people come back.
We do.
Come back.
Yeah. Yeah. It's important to meet people where they're at, right?
Mhm.
Um, but just like if you're trying to get in shape,
Mhm.
you go to the gym, and especially like right when if you haven't been to the gym in a while, and you're going back in, you might be a little sore,
Yeah.
right? I mean, it's
Yeah.
not necessarily easy running on the treadmill or, lifting some of those weights. It is challenging, and you are getting stronger through
Mhm.
it.
Mhm.
And you need to keep going back to the gym, right? To like keep getting strong. If you're just like, oh no, I'm out, that was too much. You can modify your workouts just like you can modify the therapy.
Mhm.
Um, Maybe you do less time or you do more reps and a lower weight or but you're still making that progress and working towards getting stronger, getting healthier, and being able to live the life that you want to live.
I love that. Yeah. And the CBT component, I think it's also
Yes.
important.
Yeah. So in the CBT component, we are helping people look at the way they're thinking about substance use,
Hmm.
and then behaviors that will
Hmm.
help to set them up for success, whatever that looks like for them.
So, for example, one of the thoughts that just immediately popped in my mind is, I need a beer. A beer will make me feel better. That is a thought.
It's a thought,
It is a thought. It may or may not be true. Um,
right?
the
Right.
beautiful part about CBT is you get to look at all your thoughts, and for maybe for the first time thinking about, I've thought that for 20 years, but wait a minute. Is
Yeah,
it true? Does it make me feel better?
exactly. Right.
Did it take the pain away? Was I better? Or did I
Yeah,
just start crying?
right. It's the fact that we have thoughts, but not all thoughts are facts, right?
Hmm.
So it does create a pause,
Hmm.
right? Like just pause and think about what you're thinking.
Hmm.
Um, and then, yeah, ask yourself, is that really true?
Yeah.
What's the
My
evidence for that?
My favorite example of that is public speaking when people, even coming on a podcast, for example, but when you
Yeah.
get up to present information in front of a group of people, most people have increased heart rate.
Yeah.
It's just really common.
Right.
Some people have the thought, I'm gonna die. I am not gonna
Mhm.
survive this. I feel my heart going. This is horrible. I'm
Yeah.
gonna die. Other people, they feel that same sensation, the heart's racing, and they're like, I'm so excited.
Yes, it's
Game
so
on.
true. I
So
love this. Yeah.
it's just the two different thoughts.
Right.
They just think all we're saying is take a moment to think about if what you're telling yourself is true.
Yeah.
Is it true that you're going to die if you have increased heart rate because you stood in front of a group of people to talk? I don't know anybody who died
I don't either.
giving a talk. I've never seen anybody run out of the room screaming. Like,
Me neither. Yeah. So, so
I
things
have
are
seen people nervous,
sure.
but
Yeah,
they
of
survive,
course.
and the whole
That's
room usually
normal.
has compassion for them. They're like,
Yeah.
cheering them on.
Yeah, absolutely. And the more they do that, the easier it's going to get. It
Hmm.
may never be totally easy, right?
Hmm.
But the more comfortable that they'll get with that, and then they'll recognize that wave of anxiety of like, okay, I'm doing something really important, big here, like I'm giving a talk in front of people.
Hmm.
So, like most people, heart rate's going to come up.
Heart rate will
That's
come up.
that's just a normal part of this,
Hmm.
and it's going to come down at some point. It won't
Hmm.
last forever.
And it could just mean game on. I'm excited.
Yeah,
I'm
that's
here to
true.
talk.
Right. This is
I have something
awesome.
to say. Yeah.
Yeah.
Yeah, be willing to just think about really all the ways you could think about that one sensation. You feel
Yeah.
your heart starts to race.
Right.
And so there are all sorts of ways to think about it. You don't have to agree that the one that automatically comes to mind, I'm gonna
Yes.
die, is the right one or the true one for you. Just think about it.
Exactly.
So that's the
Right.
cognitive part.
That's the cognitive part, right? And then behaviorally, um, we might also talk with them about like sometimes people will keep substances in their home.
Hmm.
And if they're trying to cut down or quit, that can make it harder, right?
Hmm.
So like I love chocolate chip cookies, right? And if I have them in my home, I'm probably at some point going to eat one or more of them. Maybe one day things are good and it's okay and I don't have a cookie, but then there's that day where, I don't know, traffic was problematic or very stressful things happen at work or whatever, and you get home and there's that cookie. And so we want to recommend not, to have those in your periphery so
Hmm.
that you can use other skills. And it makes it, it's not impossible still, right? That you would use, but you would have to then go leave your house, go somewhere to get something to
Hmm.
use. So it's one more step in that.
One more step.
Yeah. And then
Yeah.
we do behavioral activation as part of our in vivo exercises too.
Hmm.
So we want to get people active. We want to get them reconnecting with friends or family or things, that are important to them, activities that are important to them.
Mm-hmm.
And a lot of times people with PTSD and substance use can also have depression.
Mm-hmm.
And so with behavioral activation, we can help them widen their life a little bit more and
Yeah.
decrease some of that depression too through doing that.
Yeah, PTSD really does shatter. I introduced it initially as really kind of changing your sense of safety, but it can change your sense of self, change your
Mm-hmm.
sense of connections with others, change
Yeah.
your sense of your space in the world. It can really dramatically impact your life. And so COPE and other
Yes.
treatments like that
Right.
can help you reconnect with self, reconnect with your own sensations, your own thoughts, your own desires to get out there and do certain things, and
Right.
help you reconnect with others, safe others,
Yeah. Safe
and
others.
reconnect
Right. Right.
with your purpose, your meaning, because there is still purpose and meaning in your life,
Mm-hmm.
um, as opposed to maybe just wanting to stay safe, which is,
Right.
potentially the tendency.
Absolutely. Yeah. And that's a great point that you made, that the changes that can happen in terms of how safe or unsafe people feel are
Mhm.
usually vast and wide reaching. It's not
Mhm.
just feeling unsafe in one particular area of life. It can really be across the board. And so, we'll talk to people about, okay, it's true that unsafe things can happen, right? It's probable.
Mhm.
I'm sorry, is possible, right? There we go. Always get those mixed up. It's possible this could happen, but how probable is it? Like, let's say someone who doesn't want to leave their house or drive a car, maybe they were in a horrific car
Oh.
accident,
Mhm.
but their son is having a football game
Mhm.
and it's really important for them to be there. They
Mhm.
really want to. They want to be there and support their son. So it is possible they could get into a car accident on the way there.
Mhm.
But what is the probability of that? And is that small probability worth the risk,
Mhm.
um, or worth them giving up being able to be there, at their child's sporting event that
I
night?
think that was a great example of CBT because it shows the C, the
Mm.
cognitive components, the thoughts and how to modify your thoughts, and the behavioral components of getting out there.
Yeah.
Great
Okay, great.
example. If somebody listening is worried about themselves or a family member, a loved one, and would
Yeah.
like to reach out and get treatment or learn more about these treatments, where could they get this information?
Yeah. So they could, a lot of times people will start with talking to their primary care doctor,
Okay.
depending on where they live,
Mhm.
and just asking for some recommendations around that, in terms of therapy, who they could go to. If they are a veteran, then the VA has done a really great job in terms of um, investing in and training clinicians and trying to, continuing to build support
Mhm.
for veterans with PTSD and substance use disorders. And many of the VAs will have a PTSD clinic, they'll have a substance use disorder clinic, and they'll have a liaison that
Mhm.
goes between those. And so you could reach out to your local VA or community based outpatient clinic.
Mhm.
The National Center for PTSD, on their website, you can find providers there too.
Okay.
And then at SAMHSA, if you go to the SAMHSA website, Substance Abuse and Mental Health Services Administration, they have findtreatment.gov. So you could go to findtreatment.gov, and a lot of treatments and programs and treatment facilities. I'm more familiar with the substance use disorder ones, but they do have dual diagnosis programs.
Okay.
So
Perfect.
they recognize that people who are struggling with substance use disorders often are struggling with other mental health conditions that are
Mhm.
impacting their substance use.
Mhm.
And so they offer dual diagnosis program and look for trauma focused, evidence based treatment.
Okay. Perfect. Thank you for being with us. today. Dr.
Thanks for
Back, you're
having
awesome,
me.
wonderful as
You are
always.
too. Thank you.
And thank you for listening. If you or someone you love is struggling with a mental health or substance use condition and you want help, you can go to our website, choosinghelp.com. We will have information about both COPE and Dr. Back's book, the manual, and well, maybe not the manual.
Or links to it. We could have links to it.
Okay, we'll have links to the manual and then also to that SAMHSA website, findatherapist.gov,
Yeah.
choosinghelp.com. And if you want to get in touch with us, you can um, get in touch with us directly, either Stecker at musc.edu or get in touch with us at our website, choosinghelp.com. Thank you for being here.
Thanks for having me and thanks for elevating this topic too and sharing with the community. I appreciate you.
I appreciate you.
Okay. Thank you.
We would like to hear from you. We would love to hear more from our community of listeners. Do you know someone who is struggling with a mental health condition and you would like to help them, but you're not sure what to say? Please feel free to get in touch with us. There's two ways that you can contact us. One is at choosinghelp.com. The other is you can email me directly. My email is Stecker, Stecker, at musc.edu. If you know somebody who's struggling, you'd like to get some help on how to help them, feel free to get in touch with us. We would love to hear from you. Also, if you know of some success stories, you know somebody who is struggling and they really work through it, we would love to feature them. We would love to hear about them. Please feel free to share the stories of their success. If it was you, please feel free to let us know about your success. We would really like to know. We'd like to hear more from you. So, choosinghelp.com is our website, or you can email me directly, Stecker at musc.edu. Welcome to Choosing Help.